Cool. We're gonna get one into this upper trap here.
Woo!
Yeah.
Yep.
Get some jumping in there.
Yeah, I definitely felt it.
Yeah. Good. We'll let that one sit. Hey everybody, Dr. Angie here, and we have Tanisha. All right, so she's having some mid-back pain, a lot of tightness. We're blaming work, but we're not blaming us. We're gonna fix it today. Exactly. So we're gonna do some dry needling to that area. So we're gonna get right in between those shoulder blades, where a lot of people hold a lot of tension. It comes from using your arms. If you're doing a lot of reaching forward, that pulls through that middle part of the back and creates a lot of tension there. So let's get started. I'm gonna have you lay face down for me. Get that lovely little arm sling underneath so you can relax your arms there. I'm gonna get the lovely hair out the way. Cool. Right in here.
Woo!
Yep.
Yep.
Right side worse than left, or both about the same?
Left side's worse than right.
Oh.
Ooh, that is literally the spot.
All right. Anything up through here?
A little bit of tension there.
We're gonna clean the area. A little cotton swab. All right, we're gonna get into these areas. Yep.
Okay, that wasn't bad.
That wasn't half bad.
I mean, sorry.
Wow, I didn't even feel that one.
That's 2 weekends.
That's how you know we did it right.
Right.
Oh, George Strait. And Chris Staples in a parking with and stuff.
Woo!
That was a spicy
Yeah.
one. Good.
That's exactly the spot too.
Keep breathing. Keep breathing.
Right. Woo! That, I literally can't even explain what that feeling just felt like, but...
Come on, needle. Come with me. Come along. There it is.
Oh, did we really? Like at some random bar. Yeah.
Cool. Oh. We're gonna try that one again. Needle keeps wanting to flex with me. The benefit and the struggle of them being so thin, here it is. Yeah.
But it's not at Baltimore, though.
Cool. We're gonna get one into this upper trap here.
Woo!
Yeah.
Yep.
Get some jumping in there.
Yeah, I definitely felt it.
Yeah. Good. We'll let that one sit. All right, we're gonna get the other side.
There's more.
There's more. But wait, there's more.
Okay, Billy Mays.
Yeah, but by the way, it's the same thing as like your last condition. I'm not worried about pinch nerve, anything like that.
The one I have here is a little longer on this, just because I ran out of the other ones that were on the table. But I'm just not going in as far as the other ones do.
Wouldn't make that big of a difference.
There it is. Yay! I'm gonna get in here. Getting more.
Oh, Lord. Oddly enough, I feel very relaxed.
Good. As you should. Oh, this guy.
Alright, there. Can you tolerate that for 10 minutes? Yes. Not too much? Alright. So yeah, in the meantime, from now until I see you next, back like 10 to 20 minutes.
Good. Last one here.
It's all bad, because you know how to recommend those. Yeah. And just make sure you don't stretch with the basketball. other than that, yeah.
Awesome. All right. You get to hang out here for 10 minutes, okay?
All
Get to
right.
relax in it. All right. All done.